Hello, this presentation is on Duchenne's muscular dystrophy for the Capella University Advanced Pathophysiology course. Duchenne's muscular dystrophy, DMD, is the most common and the most aggressive type of muscular dystrophy. This disease is characterized by a loss of muscle function and muscle wasting. Every form of muscular dystrophy essentially results in that muscle wasting and loss of muscle mass due to the abnormal or mutated genes found on the X chromosomes. These mutated genes interfere with the normal production of proteins called dystrophin, which are used essentially to form healthy muscle. About half the people diagnosed with muscular dystrophy have Duchenne's type. Duchenne's primarily affects boys, about 1 in every 3,500 born each year worldwide. Onset of Duchenne's typically is seen between the ages of 2 and 3 years. It's usually noticed by the parents. The toddler may begin to have frequent falls, have difficulty getting into a sitting position from the floor, trouble walking or jumping. A waddling gait or walking on the toes is typical. Enlarged calf muscles are noted, and muscle pain and stiffness are common. Speech, educational delays, learning disabilities are often noted as well for these young toddlers. Diagnosis of Duchenne's is first started off doing blood tests where CPK levels or creatine phosphate kinase levels are drawn. CPK is an enzyme that is normally stored in the muscles, and if it's elevated, it indicates muscle damage. So that's the first line of tests being done. The diagnosing test, though, is to have genetic testing, either blood or muscle biopsy. The muscle biopsy is the gold standard for a diagnosis of Duchenne's, though. This slide shows the typical symptoms of onset that I mentioned. The posture of the toddlers, where their shoulders and arms are held backwards. They're awkward, they're clumsy, there's poor balance, weakness of the muscles in the legs and hips and buttocks. The enlarged calf muscles are noted. This just gives a good illustration. Musculoskeletal function is the primary body function that is affected with Duchenne's, where there's a rapid progression of muscle wasting and weakness noted. Physical therapy with the use of braces and mobility aids are common. They are used early on, but unfortunately, typically by the age of 12 years, these boys are generally wheelchair bound. The spine is often unable to support these severe scoliosis that occurs in the adolescent years, and osteoporosis and fractures are very common with these young men. Cardiac complications occur with Duchenne's. The heart is a muscle, and so it also will weaken and waste away, resulting in cardiomyopathy. Early detection of muscular dystrophy-associated cardiomyopathy is so important, because if we can begin cardioprotective medical therapies like beta blockers and ACE inhibitors, it can help slow the cardiac heart failure symptoms that occur. Typically for these young men with Duchenne's, cardiomyopathy is the leading cause of death for 60 to 80% of the cases. We really need to start treatment early. Respiratory complications also occur because the diaphragm begins to weaken, the spine is already having severe scoliosis occurring, which limits the diaphragm's ability to expand and decreases lung capacity. Most boys require the use of a ventilator to support respirations by their late teens to early 20s. The death of young men typically occur either due to the cardiomyopathy we talked about or by respiratory failure in their early mid-20s to early 30s. Urinary and gastrointestinal function is affected with Duchenne's, but primarily in the late stages. Due to needing assistance with toileting as progression of disease occurs, many young men will reduce their fluid intake to avoid the need to go to the bathroom during their work or school day. This may lead to dehydration, or it may end up having frequent urinary tract infections due to the postponement to void. Gastrointestinal function is affected. Bowel evacuation dysfunction occurs due to the non-ambulatory phase and the non-mobility concerns. People who suffer from Duchenne's have endocrine concerns referred to as hypogonadism, resulting in delayed puberty, growth failure, osteoporosis, and metabolic abnormalities. Additionally, testosterone levels are affected with hypogonadism, and men with Duchenne's tend to have lower total testosterone levels and reduced spermatogenesis, resulting in erectile dysfunction and decreased male fertility. Testicular atrophy is reported in approximately 80% of muscular dystrophy patients. In general, testosterone levels decline due to the muscle wasting that occurs. Testosterone therapy replacement may benefit and should be considered for treatment in Duchenne patients. Research has indicated that males with Duchenne's have increased prevalence of attention deficit hyperactivity disorders, autism spectrum disorders, and obsessive compulsive disorders as compared to males in the normal population. These results essentially support the view that Duchenne's is not only a muscular disorder, but also a disorder affecting the brain. Sensory function is also affected. There's no specific condition of sensory dysfunction linked, but many parents do report sensory processing disorders such as hypersensitivity to tactile stimulation or aversions to messy play, or having picky eaters due to textures of food, or having noise intolerance. Just a note too, depression is commonly seen as the disease progresses for these young boys as they begin to lose their independence. Duchenne's is a non-modifiable disease process. The flawed X chromosome mutation occurs during cell division in early stages of pregnancy and can occur in any pregnancy. There is no cure for any variation of muscular dystrophy. If high standards of care are received at a very early age, the young man with Duchenne's may be able to live into their early 30s. Primary interventions are limited for muscular dystrophy individuals since the process is not modifiable and cannot be prevented. Secondary interventions include early detection of symptoms and testing, again with the serum CPK levels and muscle biopsies to determine diagnosis. Tertiary interventions for boys with muscular dystrophy focus on early treatment to help manage the disease and help maintain optimal health as the disease progresses. The main treatment for Duchenne's is corticosteroids. Steroids help improve the muscle strength and function and slows the progression of muscle weakness and delays the onset of respiratory and cardiac dysfunction. We have to watch for side effects with prolonged steroid use, though, which include weight gain, reduced bone density, hyperactivity, decreased height. All these things should be monitored closely. Physical therapy helps to strengthen and slow the progression of muscle wasting as well. Incorporating technology for Duchenne patients is very important. Diet and exercise, computerized programs may help to promote health maintenance and increase activity levels for these young men. It is important to help maintain their weight at a healthy level and to keep their activity levels as active as possible, just to decrease the progression of the disease. Introduction of equipment as the progression of disease limits mobility is important, like providing electrical wheelchairs and slings for transfers for large mobility assistance. Computers and iPad applications for fine motor loss to assist with communication and productivity are commonly in use. Portable ventilators and monitoring systems like oxygen saturations also help to assist when respiratory functions begin to fail. This slide is essentially a concept map for Duchenne's, from the onset of symptoms going down to testing to diagnose. If a positive diagnosis occurs, then we need to start treatment right away. Aggressive therapies, corticosteroids, supporting cardiac and respiratory function as the disease progresses. Thank you for listening to the presentation. I hope that the information provided gives you some background and some knowledge on Duchenne's muscular dystrophy.